So when I stepped into this role, like I said, about a year and a half ago now, maybe a little less than, I really made it my goal to just go around and get to know my people, my teams. Who are they serving? What are they doing? And kind of what are the sticking points for them? Because I had come from the quality team, where that's kind of a lot of what we do, but on a different level, more on the regulatory basis. And what I had heard a lot from my interventional team here is patients take forever to get in. They're crabby when they come here. They're in pain. And it was just constantly like, they're 54 days out. They're 2 months out. They're 2 months out. And then when they come in, that they're then further out for their interventions, right?
Yeah.
Patients are coming in to then get most of the time injections of sorts in their back, spine, neck. So one of the things I did was use like I said, my data background and just pulled everything I could, tried to see what is the data actually saying, because staff can always say we're really busy or patients are really far out. But in rural healthcare, like I said, we don't have the reports that just push to you and say, this is what it is. So I used what I knew and the tools that I had access to and was able to determine that, yes, our third next available appointment time was 54 days, which is a long time.
Wow, it
when
is.
we're serving like very much a blue collar community, right? These people are in pain, not able to work, and not getting the care that they need from our community hospital. So we spent a lot of time, myself, the providers, the APPs, the nurses, the schedulers, we sat down kind of week after week and just picked apart a different piece of the flow, whether it was the room utilization, the biggest part was the provider schedule templates, other provider workflows. What were they doing with their time that was holding them up from seeing more people? And I think what I'm most proud to say is that we didn't have to add any additional staff to get this done. It really was using the data and working with the people and the teams that I had here to improve the access. All we did really was change the schedule templates, make it so that if there's an emergent patient, there's a same day spot available. We had a team of five providers. So really, we shouldn't be having these patients wait that long. We have the tools and the people we need to do a good job. And ultimately what it meant was for patients, they were able to get their faster relief. If we can get them in for their initial visit earlier, they then can get their interventions and get back on that path.